Drugs and pregnancy. It's no secret they don't mix, but new research hopes to establish just what effect pee has on unborn children. Coincidentally, a woman's been jailed for breastfeeding while she was taking pee. Dr. Trecia Wouldes from Auckland University is with us now. Trecia, we know that alcohol, as a pregnant woman myself, I know to stay away from it. It just seems absolutely absurd that women would be pregnant while on pee. Why do we need to do this research?
Well, methamphetamine is a very addictive drug, and I think if you've become addicted prior to being pregnant, it's very hard to get off methamphetamine. And at present, we don't have any treatment to, give them that is safe for the baby to help them get off the methamphetamine. For instance, with opiates, we've got the methadone program, and that's been proven to be successful in treating women who are opiate dependent, but we don't have the same kind of treatment for women who become dependent on methamphetamine.
So the fact that we're doing this research suggests that there are a lot of pregnant women in New Zealand using pee.
Yes, there are, particularly in the North Island. We started our research in 2006, and we've got 120 methamphetamine users in our longitudinal study and 100 comparison mothers. And I think we could continue to recruit. We've quit recruiting, but we could continue. And when we look and ask them about how long they've been using methamphetamine, it seems like it's a longer problem than we had first envisaged, because a lot of them have had 2 or 3 babies while using methamphetamine. So it goes back about 10, 15 years.
So part of this research is you want to know what the long-term effects are on these children. What do you know already about how pee affects these kids?
Well, our first results that we published were looking at the neurobehavioral effects of methamphetamine on babies at 1 month. And we found that in New Zealand and in the US population that there were neurobehavioral effects of methamphetamine. Now, we don't know what that means long term, but the data that we're analyzing now suggests that long term in New Zealand at least, it means that these children are falling behind in motor skills, sort of fine motor skills, gross motor skills. In the States, they found that there was a delay up until about 1 year of age, but it seemed to go away. However, the research, our research is just part of a big US study, and they're also finding behavioral and self-regulatory problems with those children, but we haven't analyzed that data, but we suspect we'll find similar problems with children here in New Zealand.
Well, Dr. Trecia Wouldes, thank you for joining us this morning, and it will be interesting to see once you've completed that research, also the differences with alcohol as well.
Yes,
Thank you.
Thank you.